If it's happening in New York, New Jersey, or Long Island, hear about it with Joe Piscopo. Mornings, 6 to 10 on AM 970. The Answer.
What is this? What is this? I want music that kind of blares out. This is this is jazzy.
Merry Christmas, baby.
That's it, baby. Come on now.
You should treat me nice.
Welcome to Joe Piscopo in the morning, baby. On AM 970, The Answer, baby. Great to have you here, man.
Merry Christmas, baby.
Hey, great to have you here, man. It's New Jersey. It's New Jersey in a couple months. I'm New Jersey. Going through tolls, stoned. Jersey, legalizing marijuana in Jersey. I don't think the governor-elect knows how dangerous that's going to be. You'll be going to pay tolls at the turnpike going, I can't figure out the change.
My bong, man.
Yeah. Dr. Elena Frid. Hi, Dr. Frid. How are you?
Good morning, Joe.
Thank you for coming in. Back by popular demand. Looking wonderful as always, and would love to your beautiful family. Now the kids, who gets the kids? Does your husband get the kids up and out?
He does on Tuesday.
Oh, this is great. He's such a good daddy.
He is.
We're at the Rangers game. I told you, had both kids sitting on one. Great. I love when guys are great dads and appreciate it. And you are a great family.
Thank you so much.
And you got Ethan. You got your little one who's so cute.
Thanks to you, we're getting the X chair.
Daniel goes to me. How old's Daniel now?
He's 8.
So he goes to me. He goes, hey, how's that X chair? He says to me when I see him. I said, you got to try the X chair. He loved the X chair. And also, my kids love the Dr. Frid clothing, by the way. They love that. They grabbed that. Caught their attention immediately. Dr. Frid has a great line of clothing. Before we go into what I wanted to talk about allergies this morning, but how do you get the clothing? Can you go somewhere to get that clothing for Christmas?
Yes, drfrid.com, drfrid.com. Check it out. It's insect repellent clothing.
I love
for
this.
kids.
It's brilliant concept. And you treat it with something that keeps ticks off of you and that sort of thing, right?
Exactly. We're treating it with the same thing that the military is treating their clothing to prevent infection.
Look at you from Siberia to Brooklyn to Manhattan. You're doing so great. Look at you.
Moving up in the world.
No, please. You really are. You are so on top of everything, and this what's breaking in medicine. I love that you're always a step ahead of us, Dr. Frid. You really are, because a lot of docs stay too conventional. So tell me about allergies. And I have my great guy, I have an ear, nose, and throat guy, Dr. Jordan Josephson, who's like the guy in town. He's a great friend and a great guy. But now, this morning, is there winter out? I could feel it all up in here. I could just feel it up in here like allergies. So what are winter allergies?
This is interesting because allergies, actually 40 million Americans suffer from allergies all year round. We always think spring and summer is the time for allergies, but winter allergies are definitely an issue for people. And what's the difficult part now is to figure out if you have a cold versus if you have an allergy. So how do you do that? And there's a couple of things you can look out for. First is the nasal discharge. The color of it, usually discolored discharge is probably a cold.
Right.
Clear discharge and watery is probably an allergy. Secondly, you want to think about if you have other symptoms like watery eyes and itchy throat, probably an allergy. More of achiness and chills, probably a cold. And then finally, the duration of symptoms. So allergy symptoms will last for weeks versus cold symptoms usually go away within 5 to 7 days.
Okay, you're good, though. I can see it's definitely allergies. From what you just described, I definitely can see allergies. And I can see the eye waters a little bit. So I bought that new spray mist, that Flonase spray mist.
Right.
That'll help, right?
Yes, so some of the things people ask, well, what could I be allergic to, right, during the cold season? And some of the things you have to think of is obviously pet dander, because the pets spend more times indoors. Dust mites, because we don't open our windows.
Yeah.
And then other things, particularly for this season, are mold because of leaves and yard waste.
Sure.
Or mold can also be found in damp wood, which a lot of people bring in for their fireplace. So that could be a big allergen. And of course, if you're traveling or living in warm weathers, pollen is still an issue. So what are some of the things that you can do to avoid that? Is obviously avoid the allergen, which sometimes it's impossible if it's your pet, right? And then the other thing is you can wash your clothes and your face regularly because that washes away the allergen. One thing we don't think of is actually changing your bedding frequently, because the allergen can stay in your bed. And then, of course, hydrating yourself and using a humidifier, as well as using allergy medication, which you noted. And obviously, if it's severe, you would want to see your allergist. But as you said, I'm not very conventional. So I did want to bring one interesting thing for you, which is not known and not conventional.
Old Siberian recipe from Russia? Is that what you're going to do?
No, it's actually something that I don't want to freak you out, but there's also some allergies to foods that are coming on, and about 1,500 Americans have meat allergies. So that Omaha steak would be a big issue for these people, and actually that comes on because of tick bites. And it's on the rise in our area because of a specific tick called a Lone Star tick. And it carries this, it's called an alpha-gal allergy. So the tick saliva carries a sugar that's called alpha-gal that's also found in mammalian meat. And so these people will develop significant allergies and won't be able to tolerate meat products, which is a huge problem. And it's so difficult to detect it because the allergy comes on about 2 to 6 hours after ingesting the meal. And so a patient will never draw a connection, or it's really hard to draw a connection between your meal and the development of your, stuffy nose and sneezing. Those are kind of the milder allergies, but of course they can have abdominal discomfort, nausea, and even severe allergic reactions. So that's another reason to think of ticks.
Omaha steak, so it's all tick-free.
It's
all. So I understand.
No, I'm saying that ticks can prevent you from enjoying Omaha steak because you may develop allergies.
Lone Star tick?
Lone Star.
What is that, from Texas? That's what probably Lone Star
No,
steak.
it's actually it's endemic in our area. Yeah.
Now, something else I got to worry about, being the hypochondriac that I am.
That's why you want to make sure that you're looking out for.
But you see, from the blood test.
Yes.
So I had, and we got to go. I could talk to you for hours. If you want to hang for a little bit, I had the blood test, the rundown for one of my kids because I love what you can do now.
Right.
And they have the special vial that you have to put in, and then they got to put it into, they have to ice everything out just to get a complete breakdown. Because you don't know. We don't know what's in our system.
Right.
Unless you get one of these immunology-based blood tests, right?
Yeah, so definitely recommend if you're suspecting that this is an issue for you, meaning Lyme, and that's what we're talking about.
You never know,
Yeah, you want to get a specialty test.
All right.
If you want to learn more about alpha-gal and meat allergies and other things, you can go on my website, drelenafridmd.com, and check it out on the newsletter tab.
We will, for sure. So you got to get back to your office, but hang around for a couple seconds if you would when we come back for a break, because we appreciate it always. And now, because you don't realize, and Dr. Frid, you're listening, is one of the foremost Lyme disease experts in the world, so we're very proud to have her here. Okay, at 7:58. Dr. Elena, thanks for joining us. We're going to... that microphone, there's you.
Thanks so much for having me. I'm going to get used to this. You're having too much fun here.
You got to come. You are welcome anytime. So you get on a subway now. You go back to your office.
Going to the office.
You have patients in your office. God bless you, girl. You are an inspiration.
Thank you for having me.
No, I love to Ethan and Daniel and to her husband and everybody else, and you're welcome here anytime. Thanks for all the information.
Thanks, everyone.
Where do we go, Dr. Frid?
ElenaFridMD.com.
Look at that right there, live from New York. Thanks, Dr. Frid. Travel safe. Gets on the subway. Look at this girl. Frankie, watch her back. Will you on the way out? Thank you very much. Thanks, Elena. Great to see you. God bless. Give my love to the family. Joe Piscopo coming right back at you. 877-970-2999, live from New York City.
If it's happening in New York, New Jersey, or Long Island, hear about it with Joe Piscopo. Mornings, 6 to 10 on AM 970. The Answer.